So a time when honesty, integrity, and patient advocacy has been really important has been I was assigned to a patient who had previously had a stroke, and she had been in the hospital for a long time. She was ready to go home. She was mostly nonverbal. She could kind of shake her head yes or no and verbalize no, but she could not formulate words very well, like very, very, very minimal. So vocabulary. So her daughter was at her side and was, kind of wondering what's the game plan. And so I was like, I'm just a student nurse, but I can look through her chart and see if there's anything that sticks out to me that I can communicate to you. So I looked through her chart, and all of her kidney values were trending in a negative direction. Her BUN, creatinine, GFR, none of it looked good. And she had received dialysis and they improved, like previously, like I looked back, she had received dialysis and they had improved, but since then they had just been trending downward. So I saw that, and because I don't feel like as a student nurse, especially that early on in my schooling, I could interpret this and tell her any of that. I didn't feel like that was my role. I kept looking, and I saw in the notes that the most recent note from the social worker was saying that they were preparing for discharge. I also looked back further, and it looks like she had been scheduled to have a permanent dialysis port be put in, but the patient had refused it. And so I looked at the notes and the details, and when they came to get that patient, she said no. So I don't think that this woman knew that what she was going for, what procedure she was going for, and why. I don't know that she even has the ability to comprehend that. And so I don't know that she has the ability to say no to a procedure that she needs. My thought as a rookie student was that if she gets discharged, she's going to come back in kidney failure, and more damage may have been done to those kidneys where I think she needs dialysis. So I went to my clinical instructor and I was like, hey, so this is my interpretation of this. Does this make sense? And she kind of agreed with me. And so we talked to the nurse. We kind of talked about what could be done for that patient, and that maybe she needs to be rescheduled for that permanent catheter. Maybe she needs somebody who's able to make those, not like a power of attorney, to make those decisions for her, because maybe she's not competent to be able to make those decisions. So I think that, just kind of getting that in order, or getting that in place, like getting those things working, like, hey, there's some inconsistencies between what the social worker is saying, who's preparing her for discharge, and what her lab work is saying. And so I just kind of advocated for her and made that known, both with my clinical instructor and with the nurse, and then let the nurse kind of handle. I was still super new. And so the nurse did go forward and work on trying to remedy that. So